as the practice of medicine is changing, ICD-10 now is here. Doctors are all confused. We don't know about the codes, and we're spending less and less time with our patients. There was a time that I used to see the patients 20, 25 minutes, and that's shrinking. Doesn't matter who you are and how much time you want to spend. And you can try to get out of insurances and you can become concierge medicine, but I don't think that's really the answer to all of our problems. The big message to patients out there, when you go and see a doctor, how to make your visit more productive, what kind of questions you should be asking, what preparation goes before you come to the doctor's office.
Today, it's very important for physicians to see a lot of patients. They don't spend very much time. When people are rushed, we all work with stereotypes. We default to basic heuristics, okay? So we have 7 minutes with a patient. We look at someone, the patient's age, patient's this, patient's that. We make quick thoughts about what it is. And then what they do is they order the test. How many times have you heard that? Let's order this scan, this test, this, and let's see what it shows. Because the doctors aren't getting paid for taking time for critical thinking with their patients, but the tests will get paid. They get paid for the number of patients they put through the office, not for the time spent. And that's where I see the problem. If insurance companies and the government would pay doctors for critical thinking time and pay an extra couple $100s for that instead of paying for the $1,500 test or the scan or the image, I think we'd get better results. I think we'd have lower costs, and I think patients would get better care.
Let me just say something on behalf of the doctors, and this is not to defend them. But every day, something comes down the pipeline, and some regulation, you want to try to get some sort of ultrasound or MRI, and you have people in the insurance companies who are like not educated, they have no idea, they have some algorithm in front of them, and if they see A plus B is equal to C, if you don't have B, then it's not going to be approved. And the frustration of the finances of the practice and the reimbursements, all these issues, have driven the doctors crazy, and they want to make their ends meet and take care of their patients. Is it doctors' fault that they're moving faster and jamming more patients, or is it just the whole healthcare system is on the verge of collapsing and the quality of care has gone down?
The healthcare system is driving us through its payment system. It's much easier to account for things when you can look at the charts, when you can look at all these electronic medical records. Unfortunately, the changes in medicine are better for the administration and for the billing, but they've not been better for the clinical care, and they're horrible for the doctor.
All right, so I have a few tips. Maybe you can make a comment about this. I think when patients come to the office, they should come prepared. They should have a list of all of their medications instead of the doctor going through one of those bags with every bottle and look at everything. Make a list of all the allergies that you have, make a list of all the medications that you have, and be very specific about the reason why you're there. And if you feel your doctor is not hearing you, stop, doctor, I need your help. What's the diagnosis? Should I get this test? And just questioning the doctor can stop the whole rush and basically devote. And, I hope the future of medicine would be better. But
well, you put your finger right on it. When you sense that the doctor's on automatic pilot and not really hearing you, you need to break them off out of that. And the way to do that is to ask a question. Doctor, I know I'm a little bit young, and I know I'm not at high risk for cancer, but could this be that? Or, I've been told I've had this condition for 2 months. They've been treating me. It's not getting better. Could it possibly be something else? Jog them to use their critical thinking they've got the training for and break them out of that automatic pilot.
I think that's extremely important. And also, just a little hint, I think doctors are a little more tired. When you see them at 3, 4 o'clock, try to get to see them at like 8 a.m. as one of the first patients. I feel bad for all the doctors out there. We're doing all the hard work, and nobody gives them credit, and the whole system is really, it's difficult. But as a patient, you can make it easier for yourself.
If I could just come back to one thing, I'd like to the women in the audience. They should know this. You need to be able to talk to your doctor, and you need to decide for yourself whether you prefer going the risk of having an unnecessary biopsy and what the chances are of finding a cancer there, or waiting until you actually have a clinically palpable lump and what the statistics are that it might be cancer. For a woman in their 40s, if you wait till it's a lump, it's about a 30-25% chance it's cancer. On the other hand, if you have a lot of biopsies on the screening side, you may have 90% false biopsies. So this is an individual choice, and I think you need to go to your doctor and you need to be able to have that discussion and make that decision.
And I think getting a second opinion is absolutely important. Dr. Armand Leon, thank you so much for being here, and we look forward to having you in the future.
Pleasure.
Thank you so much. All right.